Support systems. I'm not going to go into all of this, but I'm going to share just a couple of things with you that I think are very important. When we started looking at the data, and I'm a firm believer that you got to own the ugly stuff along with the good stuff. And we had a big press conference this morning with the governor. We're blowing the roof off AP exams, and that's all great. We're real excited about that. We also have 126,000 students a year with 7 or more unexcused absences in our schools that equates to 1 million opportunities to learn. So we've got to do something about that. I know the judges in the state are working with us on that. We've now put in place an early warning system for every school system in the state, free of charge, so we can make sure we're identifying those. Discipline. Again, that little experience in inner city Birmingham kind of helped me rethink discipline. I was a high school principal after that at Benjamin Russell High School in Alexander City, and used to shudder when we suspend kids. I mean, suspension really doesn't solve anything other than makes the teacher feel better for a little while and gets the kid out of their hair. If you really want to know, I mean, I haven't seen it make a lot of difference for the children, but it's made a difference for the adults, which is important, but let's remember who we're focused on. Let me give you an example of some of the policies that are currently alive and well in the state of Alabama that we're revisiting as we speak. Let's say that you, what's your name? Hey, Susan. That Susan has been absent from school for the last 7 days, and they're all unexcused, mainly because you didn't bring your excuse in by the 3rd day, but some crazy person made up that rule, which I don't understand either. It's just as arbitrary as anything else we do. But anyway, it's the rule in a lot of places. You didn't bring in your excuses, so you've got 7 unexcused absences. But you do finally come back on that 8th day, and what is the policy that is alive and well in almost all of our school systems in the state that we do to you? We suspend you and send you back home. Now, folks, there's a lot of smart people in this room, but we've been doing it for 25 years. I think it's time we rethink those policies, because that one really doesn't make a lot of sense. We also have discovered policies that say, what's your name? Hey, Bridget. That Bridget is a older sibling of 6, and her parents are incarcerated, so you've taken on the role of parent. And in small school systems like Alexander City, where I still live and where my kids go to school, we all know everybody. We keep up with everybody. But you have to take on the role of parent. And your siblings, when they have to go to the doctor, you have to take them to the doctor. If they have to go to court because of something your parents have done, you have to take responsibility for that. And inevitably, you're going to have times when you don't get an excuse and bring it back on that magic 3rd day to say it was an excused absence. We have policies in this state that say even though Bridget may have straight A's, all hundreds in all of her classes, if she has 10 unexcused absences, she fails due to attendance. Again, folks, we all knew where you were because we all know you and we know your parents, but because you didn't bring it in by the 3rd day, we've got to revisit these policies that don't communicate to our children and to our families that we really want them there. All students are provided with individual and group counseling services. The first excuse that always goes up, and no offense to any of my counselors in the room, is we can't counsel because we spend all our time testing. Well, we've shifted that equation now. So that can no longer, we're doing away with the graduation exam, we've moved testing until May. So there's this time between April and May that I think we could be doing some things with our children. Another thing that I have discovered that is not alive and well in our state is there is a requirement that every child in the state of Alabama enters 9th grade with a 4-year plan that is based on the Explore assessment that we now pay for every 8th grader in the state of Alabama, that determines their aptitude academically and their career interest and aptitude in the things that make them tick. So I would think that if we looked at that information and used it to develop a 4-year plan, we've had a whole lot more kids engaged in staying in school. And I've warned the superintendents, they know this, that as I visit schools, and I'm in one a week, regardless of what my schedule is, that's one of the first things I ask for. Show me a current 4-year plan for a 9th grader in your school. And I regret to say that it is not alive and well. So we're going to really focus on that because we can make a lot of difference for children, including special needs students, if we're making sure that their academic and career interests are matched to what we're asking them to take. And the last one is a no-brainer that all kids are provided with healthy meals, physical education, health education, supported by needed medical and related services. And another thing that you're going to see coming out is we're going to ask for a coalition of the groups that serve children in the state of Alabama. I look out my window down there and see these big white buildings where DHR and mental health and all the groups that serve children live. And I can't imagine that if I was a parent, how I would ever connect the dots to get my children served. And the adults have a responsibility to get our act together so that we create regional, local ways to connect all those pieces so that a parent has a one-stop shop when they need services. Just to give you an example of how easy that can be if the grown folks start talking together, we went over to the Commissioner of Mental Health, I guess the second week I was on the job with Mabry Whetstone, and challenged them and said, we have all these kids in middle school. And I currently have a middle school son, so we all know they're crazy. But you know, middle schoolers are just, you know, God made them that way. They're just a hormone waiting to happen. That's just what middle schoolers are. But they have needs. Most kids that get identified as needing mental health needs, the only way they can get those needs is they go to the mental health center. So who is the least likely to go to the mental health center to get services? Children who are at risk from at-risk families, because the only way they get there is for their families to take them there. So we shared with the Commissioner of Mental Health, we have students that are going unserved. You have therapists that have unbillable hours because they have nobody there to serve. What if we reverse the delivery method and you sent the therapist to the school 3 days a week, because we have a captive audience. We have pockets around the state that are doing that already, and it just proves to me that if the grown folks will sit down and talk about this, we can connect the dots so kids can get better services. So we want to make sure that that's a place we move as we move forward.